Antimicrobial resistance, or AMR for short, basically occurs when small organisms, or as we call them, microorganisms, these are like your bacteria, your viruses and fungi, develop the ability to resist medicines that are meant to kill them. Basically what happens is when you get sick or you get an infection, and it's usually caused by either a bacteria, virus or fungi, right? And so you get antibiotics or antivirals to kill this bacteria, virus, or fungi. But now resistance means that this organism is now able to overcome this medicine that you're taking. So it means that the medicine is no longer able to kill this bacteria or virus. So this usually happens when, say, you are not taking your medication right, so much so that the bacteria is able to develop mechanisms to overcome whatever effect the antibiotic or antiviral has on it. So it's basically, you can think of it as, the phrase that says, what doesn't kill you makes you stronger. So when you take your antibiotics and you're not taking them responsibly, or you are not finishing the course, or you are taking them unnecessarily, then whatever bacteria or virus was there, if it is not killed, or whatever remains and it wasn't killed, will certainly develop adaptive mechanisms to ensure that the antibiotic doesn't kill them anymore. So what does this mean for public health? Essentially, it means that any common infection that you could get, even if it was a urinary tract infection, or if it was pneumonia, or anything that is caused by a bacteria or virus, will now become harder to treat because the medication is no longer working, since this bacteria or viruses are now stronger than the medicines that we have. So this would lead then to longer hospital stays, and worst case scenario, it can actually lead to death. So it's very serious public health threat, because it undermines our ability to treat infections or even perform procedures like surgery, because, when you do surgeries, there's always a risk of infection. So we like to give antibiotics to prevent any infection. But now, if the antibiotics are not working, it means that any type of surgery or even chemotherapy would become very dangerous to perform, because you're afraid of the patient getting infections. And when they do get these infections, we are not able to treat them, so they can actually lead to death. So that is why AMR is such a hot topic right now.
How does AMR affect not just hospitals, but also communities, agriculture, and even the environment in Namibia?
We say that AMR, or antimicrobial resistance, is a multifaceted issue. So what it means is that it doesn't just affect people in hospitals. It affects communities. It affects agriculture and the environment. So I'll explain further. So in communities, if someone has an infection caused, let's say, by a bacteria that is resistant to medication, so they have this those bacteria that are resistant to medication, we like to call them superbugs. So someone gets an infection that is caused by a superbug, and in the community, when they if they pass on this infection to the next person, then the next person also gets that superbug. So you may find that these resistant infections can spread throughout communities, and then we may find that we have a lot of people getting infected with infections that are difficult to treat. So that and they take longer to heal, or they can even lead to death. That's a problem. When we look at agriculture, antibiotics are sometimes used in livestock and also in crops. So for most, you find there are farmers that use antibiotics to help animals grow, which is actually not properly scientifically backed. Animals are like humans. They also get infections caused by viruses and bacteria, so they also require antibiotics to treat them. So the same way that if it's used unnecessarily and not properly in animals, then it means that your the bacteria becomes resistant. So it means that the animal will then also be having an infection with a superbug. Now, in livestock, it's even more dangerous because now you get animals. A lot of these livestock are animals that we eat as well. So if you find that it's an animal that was sick with a superbug, and perhaps if it wasn't noticed, or say when you look at communal farming, usually when an animal gets sick, it's killed, and then we just decide to eat it, that's a problem. Also, if an animal is, say, injected with a antibiotic, but it's not given enough time for the antibiotic to, be flushed out of the animal's body. Say it was just given the antibiotic, 2 days later, this animal is gone to the abattoir for slaughtering. It means that you'll still have this residues of that medicine present in the meat. And of course, this you can't cook it out, right? Because it's a chemical that's in the body. So we end up also taking in this meat. This means that we're also taking in this antibiotic residue, and then it would be almost similar to us taking antibiotics unnecessarily. So we are all interconnected in one way or another. And when it comes to the environment, there's also an AMR factor, because you'd find that sometimes antibiotics or even the resistant bacteria that was in an animal, for example, winds up in the soil, or it's washed into the rivers, and then the resistance spreads even further. So all of this now, it means that it has entered our ecosystem. So it eventually finds its way into our food chain. So basically, the humans, the animals, and the environment are all interconnected, because we are all part of one ecosystem, and what affects one can certainly find its way to the other. So that is why the One Health approach in ensuring that we address AMR not just in humans but in all other affected areas is very important. That's why we say it's a One Health issue.
Can you just give us an example of how antimicrobial resistance has impacted patients' outcomes locally, for instance, where standard treatments failed?
We've had multiple cases in all hospitals, actually. So one, to think of just some a very recent case is that we had a patient who had a urinary tract infection. So this means that, like a urinary tract could be, say, a bladder infection, where you burn when you pee, things like that. So the patient had a urinary tract infection. The patient was given the usual antibiotics that we give for your common urinary tract infections. But this patient was not getting better. They kept coming back with the same issue. In fact, it started worsening. So the patient was admitted, and then they were started on stronger antibiotics, but they still were not working. This patient was getting worse. And so after doing labs or sending their samples to the laboratory, found that the bacteria that they had that caused the urinary tract infection was actually resistant to majority of all of the medication that we keep in our state hospitals. So what this means is that there were only, it's only one antibiotic that could work for the type of bacteria that they had. And unfortunately, that antibiotic is not one that we keep in the States. So we had to find other ways of sourcing this antibiotic or procuring it. So of course, because we are now trying or finding ways to source it, this causes a delay in the treatment, because now everything else that we have is not working for this patient, and the one medicine that could work is one that was difficult to source. So there's a delay in treatment, there's increased risk of complications, of course, as the infection just continues on for longer. And then there's also the financial impact of it, because now we have to use our buyout procedures or emergency procurement procedures to actually source this medication. And this is just one of many where the treatments that we have are not working on the patients because they are getting infected with superbugs. So it's not just a strain on our health systems, but also the patients, right? Because now the infection is spreading, the medication to help them is taking long to arrive because it's not one that's usually kept. You can imagine the emotional and the mental toll on the patient and their families. And so these patients usually, in fact, when we find that they're resistant to most of the medication, we have to isolate this patient just to ensure that this infection that they have does not spread to anyone else. Otherwise, we are doomed. So we have a lot of examples of antimicrobial resistance. This is just one of the most recent cases that we have had.
Could you just tell us more about the AMR Technical Working Group, its purpose and core responsibilities?
The AMR Technical Working Group is one that was established in response to the World Health Organization's call to action, where all the nations came together to come up with a global action plan or GAP, where all the nations decided AMR needs to be addressed as a matter of urgency. So the AMR Technical Working Group was developed, and it consisted, of course, of the Ministry of Health and Social Services. It consisted of the Ministry of Environment, Forestry and Tourism, and then the Ministry of Agriculture, Water and Land Reform at the time. So the point of the technical working group is basically to coordinate the implementation of Namibia's National AMR Action Plan. So the action plan just outlines how Namibia is going to address the issue of AMR. It's guided by 6 pillars. So looking at surveillance, looking at promoting responsible use of our antibiotics and antivirals. It's looking at improving infection prevention and control, which is IPC, and it's also looking at raising awareness on AMR. So the technical working group basically overlooks the implementation of this national AMR action plan to ensure that all of the strategies that are outlined in the action plan are actually being implemented in a coordinated manner. And so, like we said before, AMR doesn't just affect humans, it's animals and the environment. That's why we have all those ministries there combined together. In fact, now the technical working group is advancing because now we are headed to turning it into a steering committee. Steering committee meaning that we would have the ministers of the 3 ministries and the executive directors and the Ministry of Finance and all other stakeholders that we would need on board, such that the issue of AMR is addressed from an even higher level. So this basically just enables political buy-in as well to make sure that Namibia actually remains committed to the issue of AMR. So the technical working group then now advises the steering committee. We advise on policy development, we advise on technical strategies, and we also then monitor progress towards our national targets and global targets as well when it comes to the strategies that we have put in place to address now the AMR issue. So it's a lot of work that technical working group or now steering committee is headed to. We still have a lot of work ahead of us, but so far we had made significant strides in ensuring that the national action plan is actually being implemented at all levels, national and subnational levels.
So Namibia has already submitted reports to the global AMR surveillance system. How does this data inform our national response to AMR?
The global AMR surveillance system, we call it GLASS for short. So GLASS is just like in the name, it's a global database, right? So Namibia has officially started submitting all the data we have that has to looking at the trend of resistance for different bacteria and different viruses and so forth. So we have started submitting this data which basically just shows where we stand when it comes to resistance, to showing whether if we are experiencing a lot of resistance in a certain type of bacteria, a certain type of virus, and so forth. So this basically informs our treatment guidelines, because if our treatment guidelines say for this infection we are going to use this antibiotic because this infection is usually caused by this certain bacteria, if we find that there is a lot of resistance that is currently rising now for this specific bacteria, we may have to use a different type of antibiotic. So it informs our guidelines, it informs our hospital policies, our national strategies. And also when we submit data to GLASS, it means that Namibia is also contributing data to the global picture of resistance. And we are also able to gain access to technical support, globally, and we are able to compare our data with other countries and see if there are countries that have similar resistance trends as ours. How are they doing it? How can we learn from them? And how best can we incorporate that to inform our treatment guidelines and our hospital policies and our national strategies and so forth?